For most people, taking a daily 81 milligram aspirin to prevent stroke and heart attack is more risky than beneficial. Aspirin has been in use as a pharmaceutical for over 150 years, making it one of our oldest. One might assume with all this experience, we would know exactly how to use it. But today's recommendations are based on better evidence gained from better science. Originally used to treat pain, aspirin evolved to become a cornerstone for cardiovascular protection after compelling research in the 1970s. By the 1980s, it was recommended that almost anyone over the age of 50 take an 81 milligram aspirin because it makes your clotting cells slippery, thus preventing clots from forming in your arteries of the brain and heart. Even at the 81 milligram dose, bleeding is aspirin's most common side effect. Physicians have long accepted this risk, however, as multiple large-scale research studies have established this risk is low and outweighed by its great benefits. This risk versus benefit relationship has been called into question by more recent research, leading to the recommendation several years ago that only those with highest risk of stroke and heart attack should take a daily aspirin. This includes people with diabetes, hypertension, and those who've had a stroke or a heart attack in the past, as well as those who may have stents in their coronary or other arteries. Research recently published in the April 2022 issue of the Journal of American Medical Association is a game-changing analysis confirming the benefits of aspirin are indeed outweighed by the risk of bleeding, specifically among those who have never suffered a stroke or heart attack, nor have a vascular stent. 1 out of every 250 people in this category taking an 81 milligram aspirin for 10 years successfully prevented a stroke or heart attack, but 1 out of every 200 suffered a major bleeding event. In an update to their 2016 recommendations, the U.S. Preventative Services Task Force now discourages using aspirin for the primary prevention of stroke and heart attack in adults over the age of 60. To clarify, those who have had a previous stroke or heart attack and/or have a vascular stent benefit greatly from a daily aspirin, and this benefit outweighs the risk of bleeding. There are exceptions to every rule and guideline, so please, as always, consult your personal physician regarding your unique situation and use of aspirin.